Today, the province announced that it will be ramping up mental health resources for kids affected by the pandemic. Jason Gaidola joins us with more. Jason?
Premier Doug Ford and his ministers say that more than $24 million will be put towards more services for children, like walk-in primary care, programs for eating disorders, and psychotherapy. But one organization says the funding falls short of what's needed in the system right now. Ontario's Minister of Mental Health says 1 in 3 Canadians are expected to experience a mental health or an addiction issue in their lifetime, and 70% of these issues begin in childhood.
Part of their development, the cognitive development that takes place during the early years of life, takes place in the school environment.
The province is injecting more than $24 million for additional support, consisting of walk-in clinics and therapy for children and their families. And the road back to a healthy living starts with routine at school.
Well, they're so happy to be back in school. They're so happy to be with their friends. And they've never experienced this in their entire lives, being isolated within the home.
But Children's Mental Health Ontario says today's announcement is not good enough. CEO Kimberly Moran says anxiety is the #1 concern right now.
Simply isn't enough to make a dent in the very long wait times that children, youth, and families are experiencing right now.
Moran says pre-pandemic, up to 28,000 children experienced wait times for mental health services as high as 2.5 years in many areas of the province, including Hamilton. And she says volume for services have doubled during COVID. She says to fill in the necessary gaps, it would require roughly $150 million to reduce wait times to 30 days and to bring in more psychologists, psychiatrists, and social workers to meet children's specialized needs.
We've done the numbers and shown that actually that if they provide kids all the treatment that they need within the 30-day guarantee, that they will see a corresponding decrease in hospital costs. And so actually it's a really good investment for the province.
Moran says that Children's Mental Health Ontario did consult with the province and they did make recommendations during this whole process. She says in the last 10 years, mental health has been underfunded and the issue has been a major problem during the pandemic.